Hello, everyone. I'm Robert Nicholson, president of the ED Treatment Information Center. And today I'm going to be talking with Dustin Wolff, CEO of Launch Medical, home of the rocket. So let's get started.
Good.
So we're here to talk about the rocket. And what can you tell me about the science behind the rocket? How does shockwave therapy work?
So, shockwave therapy has actually been around for well over 20 years, and it's been widely used in Europe to treat all kinds of things, including plantar fasciitis, soft tissue repair, as well as erectile dysfunction and bedroom performance issues. The science behind it is quite simple. If you can just imagine in your head a device that emits a sound wave right out of the tip of the device using various techniques and technology, it penetrates the tissue on the body, and it causes what's called micro trauma in a very therapeutic low intensity way. That micro trauma forces the body to send blood flow with growth factors and fibroblasts to that area to repair the tissue. It's kind of like going to the gym. Okay, so you go to the gym, over the weeks and over the months, and what happens, right? You start to build muscle. That's exactly what shockwave or acoustic wave therapy does. In addition to that, it also clears microplaque out of the blood vessels, which we all have floating around our body naturally, right? The food we eat, the environment we're in, our body just naturally produces plaque. It's exactly the same plaque that builds up on your teeth. So no matter how much you brush your teeth, you still should be going to the dentist a couple times a year to have them clean the plaque off your teeth, right? That's the exact same plaque that's building up in the blood vessels of the penis, which is what causes lack of blood flow, right? Which is what causes lack of erections and what causes erectile dysfunction. So the science behind it has been proven over the last 20 years through dozens and dozens and dozens of clinical studies done by big urology groups all over the world, proving that it's efficacious, meaning it works and it's safe. So this isn't anything that myself or my team invented in terms of the science or the technology. What we did was we just made it affordable for the average guy.
So that raises a good point. The clinical studies have been done using very expensive equipment in a clinical
Yes.
setting.
Yes.
How does the rocket compare in terms of the treatment protocol and the specifications?
So here's what I'll say. So you guys can look me up, and my name is Dustin Wolff. I own the largest erectile dysfunction shockwave treatment clinic in the country. We do anywhere from 20 to 25 treatments every single day in my clinic. So as you can imagine, I have a ton of acoustic wave experience. Okay, I'll just throw it out there right now. I am not a doctor. I have no formal medical background, but I am a acoustic wave expert because we've done so many treatments over the years. All right. And what I will tell you is this, is that the rocket has been calibrated to put out the exact same energy signature that these, 40, 50, $60,000 medical grade devices do. Okay. So it does the same thing. Okay. The protocols are actually very similar. Ours is a little different because it's a home use, but the protocols which you can find on the website are very similar to the treatments that are done in a clinical setting.
But in terms of the frequency, the intensity, and the specifications of the device,
Yes,
you've matched the medical grade equipment that's being used in a clinical setting.
that's exactly right.
Okay. So that raises the next question.
Yeah.
You said that these devices sell for $30,000, $40,000, $50,000. How can you sell the rocket for the price that you do?
Well, I'm going to answer that in a second, but let's back up a second. Let's talk about why my team and I invented the rocket. Okay. So over the years of doing this, if you guys don't know, you guys out there that are listening right now, the average protocol to go into a clinic like mine here in the US and all over the world, you're looking at, a minimum of 6 treatments and $3,000. Okay. I mean, $3,000 is a lot of money to me, and it's a lot of money to most people. Okay. We're talking only 1 to 2% of the population can actually, afford to get this done because insurance doesn't pay for it, right? It's cash pay. So I got tired of, every 100 guys that calls the clinic, talks to myself and my staff, they get all excited about this because they hear about it and they hear about it on the radio and these big celebrities are doing it and everyone's doing this. But as soon as we tell them what the price is, you can just hear the wind come out, just blow out of their sails. They're like, I can't afford that. So that's how the idea was born. It's like, we have to be able to, make this affordable to the 99% of the population that cannot afford this. Okay. That was when the concept for the world's first clinically proven home use acoustic wave device for the treatment of erectile dysfunction and increased sexual performance was born. This was 2.5 years ago. So the 3 reasons why guys cannot get or will not get treatment in a clinic like mine is 1, cost. Okay, it's very expensive. 2 is proximity. Even though, acoustic wave therapy has become wildly popular, there's still probably under 1,000 clinics in the US that do it. So a guy in Topeka, Kansas isn't going to drive 3,000 miles or 1,500 miles to come see me, or even 500 miles to see the nearest doctor to him, even if he could afford it, because you have to come multiple times, take time off work. And then 3, the shame and embarrassment factor. Because even in today's day and age, there's still that stigma of, oh, you have ED, you must not be a man, and this and that. It's embarrassing, right? Who wants to walk into a clinic and take their pants down in front of a pretty nurse, 6 times? Like it's embarrassing. So those 3 factors are completely removed from the equation with the rocket. Cost, which we'll talk about in a second, it's a fraction of the cost. 2, proximity, right? You no longer have to live near a clinic like mine. And 3, the shame and embarrassment factor, right? The rocket shows up on your doorstep in an unmarked generic box, and you get to do this in the privacy of your own home because it's very simple. Once you actually see it, done or have done a treatment, you're like, that's it. It's very, very simple, yet very effective with no side effects. All right. So that's why the rocket was born 2.5 years ago. Let's talk about the cost. So my partner, who actually invented the technology inside of the rocket, is a very, very smart guy. He's been inventing products for 30 years. Developed a mechanism, a very low cost mechanism, to produce the exact same energy signature that comes out of the rocket, that comes out of these very, very expensive medical grade devices. If you saw these devices, they're pneumatic, they're hydraulic, they're very complex. Okay. And they're expensive and to make, right? And I'll tell you, the ones that I own are north of $30,000-$40,000, and I own 3 of them, and they break all the time. No, and when they break, it costs thousands of dollars to fix them. And I have 3 rooms going all day long. So imagine what my monthly bill is to repair these things. It's in the thousands and thousands of dollars. Every time one of the handle, we call it like the pistol, breaks, you're looking at $3,000 or $4,000 as a clinic like mine, and they go out every couple of months. So as you can imagine, that's why these clinics have to charge so much, right? To be able to pay the bills and stay in business and be profitable.
Right.
What we've done is removed the complexity of that, created the exact same energy signature into a device that we can produce and put into the hands of guys all over the planet for $749.
And the home device, because it is intended for use by one person, it
Correct.
doesn't have to have the durability of something that's treating patients back to back all day.
Hundreds of patients a month. Exactly.
Yeah.
So you got to imagine, like, these machines take a beating in here, right? So we're producing this home use device that is just meant for one person, and they do 6 to 12 to whatever 24 or 50 treatments, 100 treatments over the course of a year or two. It's not doing thousands and thousands and thousands of treatments. And I should also say, my engineering team, they're very, very smart, and they built in the protocols into the electronics of the device and safety mechanisms that don't allow a guy to overtreat. So we've kind of dummy proofed it, because you know how guys are. They're like, oh, if a little bit is good, more is better. So our number one concern was safety. So we built into the device a shut-off mechanism. So after one treatment, the device won't turn on again for 36 hours, right? Because you have to allow the body time to repair. Okay. Even though there's no downtime and side effects, we're still causing micro trauma and increased blood flow to that area. Okay. So you got to allow the body to repair. So we don't have guys sitting there all day long with the rocket in their hand. Oh, more is better. More is better.
Yeah, that's a very good point. One I wouldn't have thought of. So that's amazing that you've built in those safety protocols.
Yeah. So if you think about it too, I mean, we have the final prototype that we came out with last year. We've tested and tested and tested again and haven't been able to break it. So it's done. And I should also say, I mean, we the last 2 years we've done dozens and dozens and dozens of rounds of clinical studies in my clinic using the rocket with guys that volunteered who couldn't normally afford the standard medical grade machines. So as soon as I called these guys up, I had a list. You can imagine out of hundreds of guys are like, I want to do it, I want to do it, I want to do it. So those are the testimonials that you'll see on the website. But when you're talking about the value we're providing here at $500 per treatment for an in-clinic shockwave treatment, I mean, the rocket, we haven't actually, the final prototype, we have no idea how many hundreds of treatments it could do. So I will say though, the forces inside the rocket, just like these medical grade devices they're very powerful. I mean, you're talking about boom, this thing is creating a shockwave. At some point it will wear out and it will become less efficacious, right? So you'll want to buy a new one, but we don't even know how long that's going to be.
Okay. So I have one final question for you here.
Yes.
I know that you have been affected, like everyone else, by the virus outbreak in China, and I know that's affecting your shipping. So
yes,
where are things today?
So yes, everybody's been affected on a global scale, including us. We're no exception. We're not special. Where we are at right now is the fact. I will say this: the partner that we have is very unique in terms of manufacturing. Our manufacturing partner, we've had a relationship with for 30 years. They're very, very good at what they do. They build parts for Tesla, Ford, GM, Honeywell, McDonald's, every big brand you can imagine. So they are the best of the best. They are back up and running, full steam ahead. They've been in full production with the rocket for the last 2 to 3 weeks. So they're building rockets like crazy right now. There is a delay in the shipping because there's so much product coming out of China right now just because of the huge delay. So, I mean, even if you go on Amazon, I don't even think there's Amazon Prime anymore. It's just like, okay, well, you'll get it in a week or you'll get it in 2 weeks or whatever. So here's where we're at. There are production grade rockets sitting in rocket boxes at the factory right now, ready to be shipped. So it's just a matter of, and we are air freighting them over. We are not, because our rocket customers have been waiting, for some time. So we are paying the extra money to air freight them over and not putting them in a shipping container that we get 30 days later. I mean, we're talking within just a few days. So what we are expecting is an update from them this week on exactly when we'll have our first very large shipment, which could happen in the next 2 weeks. So they're being produced. We're just waiting on the shipping, slight delay shipping issue.
Okay. Well, thank you for the update and thank you for your time this morning.
Absolutely, Robert.
Story, amazing
Anytime,
story,
man.
amazing product. So thank you again, and we'll talk to you soon.
Thanks for having me.
Okay. And that wraps up this week's segment. As always, if you have any questions, visit our website, use our contact form, reach out to us and ask. Thanks a lot.